Good morning. Today we'll be discussing on UTI and you'll be having similar videos from me and I'll be naming them as selfie short vids which will fetch you a lot of data in a small span of time, less than 3 or 4 minutes. So stay tuned to these kind of videos. In case of UTI, I would like you to understand that it encompasses 4 important things. The first thing is it involves acute pyelonephritis. Also, it involves acute cystitis, prostatitis, and asymptomatic bacteriuria. As baffling as it may sound, remember, asymptomatic bacteria is not UTI, but it actually is a part of UTI. Please remember, the only difference is in case of UTI and in ASB, that is asymptomatic bacteriuria, the symptoms are the only differences. In UTI, you'll have symptoms, so it is mandatory that you have to start them on antibiotics when the patient's symptoms are seriously becoming worse. But in case of ASB, you don't have to go for treatment. But there is an exception in that also. In case of ASBs, when do you go for treatment? When the ASB is actually found in pregnant females. Why? Because if at all the ASBs are allowed to thrive in case of pregnant females, then that adult pregnant female can go for symptomatic infections called as pyelonephritis, and also she may deliver low birth weight babies. Also, we'll try to learn a few definitions before we try to answer any kind of questions in UTI. Remember, the meaning of the word uncomplicated UTI is always pointing towards a female, and also it has to speak about a non-pregnant female. Then that particular non-pregnant female should not have any kind of anatomical abnormalities, and there should not be any instrumentation in her GUT going on. Also, what is called as complicated UTI? Any UTI that does not come under uncomplicated UTI automatically becomes a part of complicated UTI. And also remember, when they use the word recurrent UTI in case of infections, it does not necessarily mean the UTI is complicated. You can always have uncomplicated yet recurrent UTI. Now, when I say the females are more commonly involved in UTI than that of men, there is an exception. Infants, that is children less than 1 year of age, and men who are more than 50 years of age. Remember, infants, when it comes to men, that is male infants, they are more prone for congenital anomalies than that of infants who are females. Point number 1. So that would make male infants more prone for UTI than that of female infants. Next, when you focus on male who are more than 50 years of age, they have prostatic hypertrophy, which will push the chances of having UTI more, but that would make sure that males and females will have equal propensity of having UTI. Also, what is the single properly defined behavioral change that is capable of causing UTI? On studies, it has been very clear according to Harrison that a sexual intercourse or multiple sexual intercourse or a change in the number of partners in sexual intercourse can easily lead to infections in case of females. Also, diabetes is a very leading cause of UTI in case of females. And in case of sexual intercourse, spermicidal use will also multiplicatively increase the risk of having UTI. In case of diabetes, remember, people who are on insulin will be more prone for having UTI than those people who are having oral hypoglycemic agents. This is another statement of MCQ from PJ Chandriga. Also, among oral hypoglycemic agents, the use of SGLT2 inhibitors, which can cause glycosuria, that is, they avoid absorption of the sugar called as glucose from the urinary tract or reabsorption of glucose from the UTI. Remember, SGLT2 inhibitors can cause glycosuria, because of which you'll have more chances of UTI. And also, what is the reason for diabetic people going for more amount of UTI is that impaired inflammatory cytokines migrate into the site of GUT. Also, when it comes to males, you have 2 types of people, the circumcised people and the uncircumcised people. In terms of uncircumcised people, the chances of UTI is higher. And the reason for that is you will have E. coli, that is the most common organism causing UTI all over the world in all conditions, all sub-conditions, living as a commensal below the prepuce and also on the glands. So at any point of time, they can migrate to the GUT to cause UTI. So remember, the people who have uncircumcised activity will be more prone for GUT infections than that of circumcised people. So if you go back in this video, you'll come across a few statements which can actually go for conceptual understanding of MCQs, and you'll be able to answer them better. Thank you very much. Have a good day.